we are live. Welcome to October 2nd, 2024 meeting of the Health and Education Facility Board. I'd like to call this meeting to order, please. And considering last meeting's minutes, are there any questions or edit requests to last meeting's minutes? Being that there are none, would anybody like to motion that we approve the meeting from last meeting, minutes from last meeting?
Make a motion.
Tyler, any second?
Second.
All approved?
Aye.
Any opposed? The meeting minutes from August 21st, 2024 passed. We'd like to now open this to a public comment period. Would anybody like to comment publicly? Yes, Councilor.
Thank you very much.
Allen, yes.
Thank you very much. I'm Councilmember Berkeley Allen, and served on the Affordable Housing Committee and worked very hard to bring a mixed income pilot program to Nashville. And when we created our new housing division, they were very instrumental in figuring out the actual logistics of what would work. And 2 different rounds have come before you. They were very popular and well received, and had the potential to create 800 units when they are all built out. 2 of those are up and running, which is pretty exciting. Some of the others are grappling now with changing economic conditions, and so have approached Hannah Davis and me and Tyler from the housing division just to talk about possible tweaks to the program that was set up, just to ensure that it is not so specific that when economic conditions change, that something they thought they could do then becomes impossible to get a bank to loan you money for. So that's what has brought me here to speak to y'all today. This when we passed the ordinance that created this program, we said that changes could be made by resolution. So it will take a council resolution to do that. But I wanted to kind of give y'all the council view of what we're seeing happening, receive any feedback y'all might have, and then I will be working with Hannah on what the changes we might propose are. We have talked about, some of the specific things that were asked for was to have the abatement. Currently it's a 15-year program where the abatement lasts for 10 years, and that abatement is set by the level of affordability that you choose and the number of units that you set aside for that. But then it drops off at 15 years. That's how we do the pilots that we use for low-income housing tax credit, and that they've been able to make that work financially. They're having a harder time getting the kind of commercial loans that you get for regular for-profit buildings. So that was one request, and just some other contract changes that I will work with Josh Thomas on, because since he's the one that's done the contracts on that, to get his opinions on those pieces. Most significantly, as I said, when we created this, it sort of had a menu of 3 different tiers that you could choose, whether you're doing 80% affordable or 20% or whatever. That set what your total abatement was. We have seen the city of Chattanooga follow our lead in creating a program, but they did a formula-based one, where you just plug in, I'm going to do this many units at this percentage of the area median income, and then it spits out what % of your tax should be abated to do that. That's working well in Chattanooga. Our housing division feels like that would be an appropriate change for us to make, and we're sort of trying it on for size with some of the people that are trying to figure out how to ensure that they can move forward with the projects that they've gotten. So that's kind of an update on where the ones that y'all have approved have gone. I am so grateful that y'all have been willing to take this on and that you've been supportive of the ones that have come before you. And I hope that we will have round 3 happening soon, but it will be a slightly different program. So with that, if there is any feedback that I can take back as we go back to this process, Hannah and Tyler will probably come back to y'all at some point and explain exactly where we're going with it.
Which particular project is this?
So there are 6 that were done, that were approved, and one is Tony Giratano's on Charlotte. He has been very helpful in saying it's not working this way, but if you make these changes, I can do it, which is helpful. It's just to say, I'm sorry, I can't do it. And then I believe Ellington Capital is the other group that has been working with Hannah, so I haven't spoken with them directly. So those are the 2 that we've heard the most from. There are 2 others that simply have not begun, I think, because of very similar reasons.
Okay. Questions for Councilperson Allen? Will we be advised when these particular projects are back with you? Will you attend also to remind us that these are the ones about which you spoke?
Yes.
That would be great. I think
Yeah,
that would be
we
great,
can do
just as depending on when it is, whether it's 2 months or 7,
Yeah,
it'd be great.
they would like for it to be too, but I'd be happy to do that.
Great.
And you were also mentioning that this program is working well in Chattanooga. Are there any other major cities that are kind of like Nashville that this program is do you know?
It's a new
It's
animal.
very new.
So, I mean, we're not aware of other cities other than Chattanooga that are doing it. That doesn't mean they're not out there. We could do some check-in for peer cities that are doing something like this, but it's kind of, I mean, you know, we're gonna enter it in an innovation contest, you know, and hopefully spread it to the rest of the world, but we're kind of on the front edge learning, which is often the case when you try something new. But we'll look and see if there's anybody else out there.
Well, thank you so much for coming and presenting. Appreciate
Appreciate
your
it.
time and your service.
I may sit around and listen for just a
Thank
minute.
you. Yeah. All right, moving forward, we're looking at final approval from Vanderbilt University Medical Center for the issuance not to exceed 450 million tax-exempt revenue bonds. Who's here to, first of all, do we have anybody that wants to speak publicly regarding this? Being that there is not someone, please, the floor is yours, sir.
Hi, my name is Dwight Seeley. I'm the Assistant Vice President, Finance and Treasury at Vanderbilt University Medical Center. With me, I have Scott Phillips, who's our Vice President, Controller, and Chief Accounting Officer. Also with us is Terry Shirey, who's the Managing Director of Kaufman Hall and serves as our financial advisor. We're proposing to issue new debt up to $450 million. That debt really comes in 2 tranches. The first one being a $400 million bond offering that we hope to launch as early, issue our offering statement as early as Friday. And with that, when we think about the bond offering, it's really to fund the bulk of it's to fund 2 existing projects. One, if you travel down 21st Avenue, you'll see a large tower going up on 21st Avenue. It's 180 inpatient beds, 10 new operating rooms, and it's really kind of phase 2 of that project. The other one is the completion of floors 12 and 14 of our children's hospital. We expect that to be wrapped up in the next 12 months. So when you think about our bonds, let me jump back a little bit. On the $50 million, what we're proposing there is really a capital lease type debt structure. Really more for, we think about it like radiology, more short-lived assets than the tower, the children's hospital, et cetera. When we think about our bond offering, we believe that we have ready access to the markets. We have a very broad investor base. Issuing tax-free, tax-exempt debt also allows us to preserve some of our short-term capital, as well as, we're going to be very flexible with the tenor. So we'll probably go in with 5, 10, 5, 7, and 10-year tenors to not really just load up any one particular year. And also really, kind of the shape of the yield curve right now is going to allow us to price, hopefully at very attractive rates. So when we think about just the sources and uses of our bond proceeds, about $360 million will be par. We'll actually receive proceeds probably around $400 million. When I think about like the total debt structure, our fixed to float mix will move from about 84 to 87% fixed. And then when I think about what we measure very closely is kind of what is our, 10-year, what do we have to refinance in 10 years? That moves from about 42% of our debt to 44% with this current issue. With that, I'll ask Scott or Terry if they have anything else to add. Otherwise, I'm open for questions.
Yeah, I think you did a good job, Dwight.
Nicely done. Questions from the group regarding this proposal?
Yes, you mentioned that we're talking about a $400 $400 million bond offering. What's the other 50?
The other 50 million will be for an upcoming, financing, tax exempt financing in the form of probably a capital lease or some other type of debt. We haven't fully vetted what type of debt it's going to be. It's going to be more for like shorter term projects, right? So an MR, some type of radiology, maybe we've got some build out of some space that we'll do, and that will come up probably in the next 6 to 12 months.
Okay. So I'm sure there's a reason for this, but why are you asking for 450 and not 400 now, and then not coming back for 50 later?
Yeah, so what we were anticipating that we would have the structure of the 50 million ready. We don't have the structure of the 50 million ready yet.
Meaning the debt, so our intention was to issue $400 million worth of bonds to fund the projects, primarily the tower and the children's floors and some other operational improvements that we're making that relate to those two big projects for the most part. The 50 million was designed to be a capital lease, a tax exempt capital lease, because the projects are also related to our mission, and we intend to negotiate with a bank a capital lease structure that would be tax exempt, and the projects that we've earmarked would be the same projects that we would fund with that additional 50 million. So that debt structure is not yet done because we're focusing on issuing the bonds. And as Dwight said, the par would be somewhere in 360 range. They'd be premium bonds to get us to the 400 million total that you see that we're mentioning. So our intention is to get approval to issue the bonds at 400 million today. When we determine the capital lease structure, we would have to bring those back and get approval for that capital lease structure unless you approve it today.
And the public hearing, they're able to do one public hearing today for the entire plan of finance, but yes, we would expect them to come back for the approval of the remaining 50. If it does go to a different structure like a lease, that would have to come back. But the public hearing is, they can do a whole plan of finance public hearing that includes both.
Okay.
So should we approve this today? We're approving the 450, knowing they're going to come back and give more explanation on the 50.
On the 50, correct.
Yes.
Yeah, we can do
Yes,
that.
sir.
That's correct.
Cindy, if they end up doing something more traditional than a lease, do they still need to come back?
Well, the approval today, they could do, if they change their minds, which they might, they could do up to the full in fixed rate bonds in a public offering. That's approved. If they decide to do the 50 separately, which they intend to do, sounds like, then they would need to come back.
Okay.
Is that clear? Wait.
So they want to do the max now
Yes.
instead of coming back subsequently.
Yes. Yes. Any other questions for clarification, comments?
I do have one.
Yes.
What's the accountability then for that, from the 400 to the 450? Do they then come back and say, this is what we're doing? Was that your question?
Yeah, more or less.
What's the
Yes.
accountability? Because we've talked about that previously.
Exactly.
We don't know what that looks
Well,
like, and
the-
there's nobody tracking that. So
if
what's the
the-
accountability?
If the initial 400 as they're proposing is issued, at your next meeting, you'll get the report on debt obligation that will show that they did in fact issue that. And then we'll know, because they expect that to happen probably by the end of this month, it will be concluded, so we'll know within 30 days.
Okay.
And so then at the next meeting, there'd be an update that the first part happened, and yes, they will have to come back.
Yeah, and we
Whatever that
recognize our
timeframe.
obligation there. We intend to meet that, so if we issue 400, we'll come back on the 50. If we issue more than the 400, we'll come back on the delta there.
Thank you.
Yeah.
That makes sense. Mhm. Yeah, absolutely.
Any other questions? Is there a motion to approve? I'll move. Is there a second?
I second.
Second. All in favor?
Aye.
Aye. Any opposed? All right, final approval passes, and we'll see you soon.
All right, thank you.
Thank you.
Thanks, everybody. You're welcome to stay for the very exciting news of the election of our assistant secretary. Should you choose, I assume
You're also
somebody.
welcome not to stay.
Who brought the cupcakes?
Got some
Anybody bring
accounting to do.
Don't
All right,
leave
thank you all.
now.
Would anybody like to nominate someone to be assistant secretary, Matt?
I will gladly nominate Kenitha.
Would anybody like to second that nomination?
Second.
Seconds, all in favor?
Aye.
Aye, any opposed? All right, thank you.
Oh,
This is your virtual cupcake, a virtual cup. You are allowed to put this on LinkedIn.
Oh, wow. It's really official now.
That's right. In terms of number 6, is this something, Cindy, you want to report?
Yes, there's no action item. That's the only closing that's occurred from the last meeting of the issues that were approved at the last meeting. So that's the report. There's a state report that's required every time the board issues debt, not just this board, any board like this that gets filed with y'all. So that's the only one that's occurred since the last meeting.
Okay, and then we delayed the conversation around legal representation, because Matt, I know you might want to speak to this.
I'm sorry, could I
Yes,
just get back to that last
Yes, of course.
point just real quick?
Yes.
So the report on the debt obligations, is that gonna show us everything that we've approved so far, like year to date, compared to like the overall pool at the state level, or what's the?
It's an individualized form for each issue. And so we keep an aggregate record, which we're happy to share with anyone that would like to see that, as does the state, obviously. Because interestingly enough, the board has only had 2 issues closed this year. Vanderbilt University, which was this summer, and then this one. Those are the only 2 all calendar year that have closed so far.
Is it, so, yeah, I mean, I guess I've had questions, because we come in and we approve like a lot of money. It'd be great to know how much that is, and if there's anything that we should be targeting or staying under. I mean, is that kind of up to this funding at the state level, or is it?
It is. The state housing agency only has a limited pool. It's a per capita limit per state of affordable housing that's available. And so applicants that come before you on a preliminary basis, then they have to apply to the state. The last several years, the state has been oversubscribed, so more people apply than get approved. So not everybody that comes to you on a preliminary comes back, because they don't, for whatever reason. And with the changing economics, which you keep hearing about, it varies. But yeah, so then there's a state approval process. That's the limit. This board does not have its own limit. It's just for the affordable housing, it's strictly limited by the state. And then other types of borrowers, like the medical center, it's their financial limit. I mean, they have to do their own meet their own financial covenants.
Okay.
Does that answer your question?
I think so, yeah. Thank you.
Okay, well, you can get back to me if there's more. Okay.
Great. In terms of legal representation, the topic that you want to bring up, Matt?
Yeah, I mean, I've sort of gone just individual. I've just sort of gone back and forth on this, because I think, as a matter, just generally speaking, I think as a matter of just like good like board hygiene, it's always good to kind of, look at your, reevaluate your relationships and, solicit bids and look at your outside counsel. I also think though too, I don't see a need. I don't see any sort of like reason to do this at this. I don't see any like deficiency in the legal services we are getting, and I also think it's a pretty heavy lift, considering that we're a board that meets 6 times a year. I mean, I did talk to, I think it's Josh Thomas, and it's it wouldn't be the most complicated thing in the world, but there are a lot of different steps that we would need to take. And it's a lot of resources that Metro Legal would, not a lot of resources, but Metro Legal would they'd have to draft the RFPs, they'd have to review the RFPs, they'd have to review the bids that come in, and I don't know if that's necessary, is I guess where I'm going with it, That said, if y'all disagree, I will gladly kind of follow up with, if y'all want me to, I'll gladly follow up with Josh and kind of figure out the next step and figure out how we kind of craft RFPs and send them out and all this and all that.
And just a little history on that, because this has been several years ago, but I think it was Chris Moth that brought up, is it appropriate for us to look into that? And we talked about it as a group many times, sort of went in and out. I think the general consensus was to have you do some research on it, think about it, and sort of advise us of what you think. So what I'm hearing now is that you're comfortable with where we are, but we always want to keep an open mind about our representation, should there be some discomfort
Right.
That would be, would that be accurate?
Yeah, and I would say too, like, there's nothing, like, issuing an RFP, we don't have to have any sort of complaints with our outside counsel to issue an RFP. And when I was sort of initially kind of, and I know I sort of flip-flopped on this, but when I was initially pushing for an RFP, it wasn't due to any sort of complaints or issues with our outside counsel. It was more just, this is just something that I think a board should do from time to time. You know, I work for a company and we rely on outside counsel. And on occasion, you know, even if we are perfectly happy with our outside counsel on a specific subject matter, we will issue an RFP just to kind of see what our options are, you know, and just to make sure that nobody on either side is getting complacent. And I think that's generally a good idea. But, you know, like I said before, I just, you know, considering that we don't meet, you know, if we met twice a month, I would say, you know what, we should probably do this, you know. But we meet 6 times a year. Everything appears to be going smoothly. So my sort of inkling is let's, you know, not take that, you know, let's not do the heavy lift of getting Metro Legal involved to issue RFPs and to evaluate RFPs.
Does anybody else have complementary or contradictory thoughts around this? Otherwise, we'll suggest it's closed.
Well, I was also thinking maybe if it's based on how many years a legal firm has been with, like how we rotate off every 6 years, you know. What if it were just looking at, and this might possibly be for another set of group that comes in after, 2020, 6 more years. But maybe it's something just to look at the time frame of if they wanted different option, if there's a completely new board and they wanted to have different another options of, you know, just kind of that type of thing. Maybe that's something to look at. But I'm good with how everything is right now, but that might be an idea.
So we've got that comment noted, that'll be noted, but for right now, is everybody okay if we close this as something we've discussed about and no longer an agenda item? No? Okay, great. With that, we are done. So,
All right.
That's all we
meeting
have.
adjourned. Thank you, everybody.
Thank you.